Hello, junior researchers. Dr. Robinson here again. On the most recent episode of Botched, a D&D podcast, we were introduced to SCP-632, otherwise known as Intrusive Arachnid Thoughts, a Euclid-class anomaly. SCP-632 is a type of arachnid. However, it has a very odd appearance and a way of reproducing. One is tied to the other, so we'll get to the appearance in a second. Instances of SCP-632 average 10 to 15 millimeters in length and are highly social, living in colonies of up to 500 members. While both male and female instances of SCP-632 appear to have reproductive organs, they are vestigial and do not actually function as one might assume. SCP-632 reproduces through sensory contact with other creatures, such as humans. Should they make contact with a person's skin, should a person smell the pheromones they give off, or if a person happens to look at the hypnotically colorful pattern on their abdomen while they do a little dance, mazel tov, it's a new batch of SCP-632. The victim will begin to feel the effects within a few hours of interacting with SCP-632. At first, the victim will begin to experience mild headaches, the feeling of spider silk on their skin, and intrusive thoughts about spiders. This is because, at this moment, the victim's brain is beginning to become inundated with thread-like strands that, for all intents and purposes, looks like spider webbing. The threads are focused towards the front of the brain, and the pressure they exert on surrounding blood vessels is the cause of the headaches. The pain of the headaches, at first, can be alleviated by light tapping on the front of the head. This causes the webbing to release large amounts of endorphins. Should Class B amnestics be administered at this point, it will halt the manifestation of SCP-632, but it will not get rid of the current symptoms. However, should this manifestation go untreated, the victim will undergo physical changes. Their skull, muscle, fat, and brain tissue will begin to thin as it is incorporated into the webbing inside the skull. You can even see the web-like structures inside the victim's eyes. After approximately 6 or 7 days, juvenile versions of SCP-632 will have manifested inside the brain, causing increased stress on the body. This will increase the intensity of the headaches as well as the duration. Tapping won't cut it anymore, but a hammer will. Increased blunt force trauma will be the only thing that will release the much sought-after endorphins. This escalation of blunt force trauma will eventually lead to a cracking of the skull, at which point 80 to 200 instances of SCP-632 will skitter out of the brain. At this point, the result of SCP-632 manifestation is fatal. However, good news! With the proper medical staff on hand, 86% manage to survive, albeit with permanent brain damage and severe arachnophobia. So the next time you find yourself with a headache that just won't go away, if you can't stop thinking of spiders, do yourself a favor and report to your nearest SCP Foundation personnel. We wouldn't want those thoughts crawling out of your skull. Thank you, junior researchers. This is Dr. Robinson, signing off.